Today, I am going to take up a lesson on medical care and population. Population growth refers to the growth of human population for a particular time and space. Population growth determines density, general distribution of population, as well as population composition. It shows that since 1950 onwards, population growth is more distinctive between developed and developing countries. The world population has risen dramatically over the past century. The rapid growth in population is stressing healthcare resources the world over. Population is growing fast and healthcare tends to be less available in developing nations. There are older people who typically have a greater need for health care. As populations continue to grow and age, there will be increasing demand for acute curative services responsive to life-threatening emergencies, acute exacerbation of chronic illness, and many routine health problems that require prompt action. Emergency intervention and services should be integrated with primary care and public health measures to complete and strengthen health systems. Medical care is the maintenance and restoration of health by the treatment and prevention of disease, especially by trained and licensed professionals. This may be done with surgery, the administering of medicine, or other alteration in a person's lifestyle. These services are offered through a healthcare system comprising hospital and physicians. Medical care serves different, distinct functions. It deals not only with the problems of disease and injuries, but also with problems of birth, death, and living. It also helps maintain the society in other ways, complementing the functions of schools, court, law enforcement, and other systems concerned with the abilities of individual persons to conduct their life in society. Medical care has several important functions other than restoring or maintaining health. These other functions are assessment and certification of health status, segregation of the ill to limit communication of illness, and helping to cope with problems of illness. Thus, function of medical care includes: number 1, assessment of health status; number 2, separation of the ill from the well; number 3, care helping to cope with illness; number 4, curing of illness; number 5, prevention of illness. Medical care has great contribution in improving many people's functional ability and quality of life. It has increased the life expectancy of the people all over the world. Mortality has greatly reduced to the new discoveries of medical science. The greatest gains in life expectancy are treatment of cardiovascular diseases, diphtheria, vaccination of children, treatment of diabetes, appendicitis, pneumonia, and influenza. So, medical care is perhaps making the greatest contribution by improving the quality of life for people afflicted by disease. Emergency medical care may crop up anytime and anywhere. It aims to provide the health to a person or many people while stuck in an unpleasant and unprecedented event. emergency medical service should be active 24 hours a day. Population means the numbers of people in a geographic area. Over the 300 years, the population of nearly every major area in the world has increased exponentially, so much so that certain places have instituted incentives to couples who agree to have fewer children. Population has 5 important characteristics. Number 1, population size and density. That means total size is generally expressed as number of individuals in a population, and population density is the number of individuals per unit area or per unit volume of the environment. Number 2, population dispersion or spatial. That is, dispersion is the spatial pattern of individuals in a population relative to one another. Number 3, age structure. In most of the type of population, individuals are of different age. The proportion of individual in each age group is called age structure of that population. Number 4, natality, that is birth rate. Population increases because of natality. It is simply the production of new individual by birth. Number 5, mortality, that is death rate. Mortality means the rate of death of individual in a population. Population explosion refers to the sudden and rapid rise in the size of population. It is not only a problem in India but has also reached a menacing proportion all over the world, especially in poorer countries. In the developing countries like India, population explosion is a curse and is damaging the development of the country and its society. Our population tends to increase poverty, malnutrition, and other population-related problems. The main factors affecting the population change are the birth rate, death rate, and migration. The recent increase in the world population is due to the increase in birth rate as a result of medical improvement and the decrease in death rate. The current rate of population growth in India is 1.58% and the total fertility rate is 3.11. The amount of resources that could have available to one person a few years ago now need to be shared between two people, which is not sufficient for either of them. The population increase has led to air and water pollution, unemployment, poverty, lack of educational resources, and even malnourished women and children. The government of India has been organizing several programs for limiting the population increase and has been spending millions of dollars in controlling the birth rate. Some of the programs have been successful and the rate of increase has also reduced, but it has still a long way to go to reach the sustainable rate. Strict birth control measures like in China can be followed to decrease the birth rate. Several government-funded agencies like the Family Planning Association of India spends thousands of dollars on promoting family planning. These organizations aim to promote family planning as a basic human right and the norms of two-child family on a voluntary basis. However, the success of the family planning program in India depends on several factors like literacy, religion, and region where the couples live. The world population explosion is straining medical care resources and access. If there are more babies born, then there is greater need for all the resources required to prevent and treat illness. As the population of the world increases, the demands upon the medical care system are increasing, which is costing more money and resources. If the basic resources of life, water, food, shelter, and clothing are not met, people are more likely to get sick, putting a greater burden on the medical care resources. Population growth increases medical care costs through increased healthcare utilization and need for healthcare expansion. The world population explosion can lead to habitat destruction and resources depletion, which creates unhealthy living environment for those same population by damaging the ecosystem that support them. It is a double problem in the sense that on one hand there are less resources for people live in a healthy life, and on the other there is less access to medicine for the resulting ailments. Thus, the rate of population growth affects long-range planning of community health and medical facilities. Alteration in age composition, internal migration of racial or industrial groups, changes in population density, and urban-rural movement require current adaptation of the health program to solve the new problems thus created. Among the various characteristics of recent population trend, aging of the population is one of the most fundamental in its bearing on national health. The social and economic effects of an aging population have long been recognized. The demands on the medical care system is not the same around the world. One reason for this is that population growth is greater in poorer nations. In wealthier developed nations like Canada and United States, there are more medical care resources and less population growth. Thus, more babies are being born in places with less resource to care for them, like in India. India is the second most populous country in the world. Another manner in which the population influences demand in medical care resources is in terms of the age of the population. The greatest need for medical care comes in the last few years of a person's life. Elderly people tend to have far greater medical care needs than young people. Local population factors such as where people choose to live also impact the quality of and access to medical care. People all over the world are migrating to cities seeking employment and a better life, and consequently urban population are growing. Not all cities are ready for this population growth, so the migration results in the creation of the crowded slums. These are generally unhealthy places with inadequate water and sanitation, which has negative impact on health. However, cities often provide greater access to education or medical care, both of which are associated with better health of a population. The impact of the aging population on medical care services is hard to predict. It may lead to increased costs, or the growing number of older people may create new economic and social opportunities. There are many factors suggesting that the aging population will increase costs, such as number 1, the annual costs of medical care are significantly greater for older people. Number 2, the number of elective and non-elective hospital admissions for older people has increased more rapidly than the growth in absolute numbers. Number 3, current projections suggest that a high proportion of older people in the future will be living on their own and are therefore likely to acquire formal care. Number 4, the number of older people with care needs is expected to rise by more than 60% in the next 20 years. The fall in death rates, that is decline in mortality rate, is one of the fundamental causes of overpopulation. Owing to the advancement in medicine, man has found cures to the previously fatal diseases. The new inventions in medicine have brought in treatments for most of the deathful diseases. This has resulted in an increase in the life expectancy of individuals. Mortality rate has declined, leading to an increase in population. Owing to modern medication and improved treatment to various illnesses, the overall death rate has gone down. The brighter side of it is that we have been able to fight many diseases and prevent deaths. On the other hand, the medical boom has brought with it the curse of overpopulation. New discoveries in medical science have been able to bring in the increase in the fertility rates of human beings. Medicines can boost the reproductive rate in human beings, helping in conception, which result in an increase in birth rate. This is certainly a reason to be proud of and happy, but advances in medicine have also become a cause of overpopulation. The root of overpopulation is the difference between overall birth rate and death rate in populations. So, one of the most important measures to control population is through education. Educating the masses helps people, especially in developing countries like India, understand the need to have only 1 or 2 children at the most. Family planning and efficient birth control can help women in making their own choices. As population of this world is growing at a rapid pace, creating awareness and letting them know about sex education is an important approach.